private wings. While some doctors have opted to stay on and offer services to those who are sickly, others have opted not to stay on and have opted to actually go on with the doctors' strike. Now, this is over a number of unfavorable conditions that the doctors have stated. Perhaps I can state them. These include a very low risk allowance that they have been offered by the government, lack of PPEs, and lack of a comprehensive medical cover, especially during this time of COVID-19. Just in addition to that, a number of the doctors, there have been arguments about both sides of the coin, with some saying that the doctors should indeed carry on with the doctors' strike as they have faced unfavorable working conditions as frontliners during the war against COVID-19, while others say it's inhumane and they lack basic essential services to health, especially during this time of the pandemic. Perhaps if you can see behind me, a number of the patients are actually trying to seek services, while others are trying to get access to the wards to visit their loved ones who may be ill at this time. A number of my colleagues are actually in Kisii attending the funeral of the late Dr. Stephen Mogusu, so I'm sure we'll get more information on that in our subsequent bulletins. But that is the status as of now here at KNH. Zainab.
All right, thanks, Ngina Kiroi there at the Kenyatta National Hospital. We'll be getting more details as well as she continues to stay on over there. Well, from Nairobi to Nakuru, where our correspondent Bridget Ngana is also there in Nakuru. It is one of the hardest hit by the pandemic, and we'll also be getting what is happening in Nakuru as well. But away from that, and to Eldoret with Lois Wangoi, and is also joining us live from Eldoret. Lois, what are the medics, administrators and citizens saying about the looming medical crisis over there?
Zainab, let us start with the citizenry of this particular county. A lot of panic, a lot of anxiety following the doctors' strike onset on this particular day. When it comes to administrators and doctors, they are a bit concerned or shy to talking to us, noting that they fear discrimination later at their places of work. But just to paint for you a picture of the services the residents of Uasin Gishu will not be enjoying following the doctors' strike. Just to note, Uasin Gishu has about 6 constituencies, and who mainly the residents are in the rural areas, and you understand that private hospitals are not found within those areas. So just to say, about 90% of the population here will be disadvantaged when it comes to accessing medical health. Now, among the areas that we expect will have a bit of problems, number one is for patients and citizens or citizenry of Uasin Gishu County who suffer terminal illnesses, people living with kidney failure who require dialysis twice or thrice a week, people living with HIV/AIDS, people under the treatment and care management for cancer. All these services will not be available to them and will be disadvantaged. Another service that will be disadvantaged here is the service of child vaccinations. Remember, children here in the country go through a number of vaccinations to just ensure the quality of their health. That will not be availed because it is done mainly through our public hospitals here in this county. There is the issue of maternal health care. It will be disadvantaged if our nurses, clinical officers and now doctors will not be assisting mothers within this community. Then it means maternal health care will have some problems moving forward. And also the issue of accidents and emergencies. Granted that we are now along the festive season, and at times it comes with a bit of anxiety on our roads leading to accidents. It is expected that persons in this county who will find themselves in one emergency or another, or even in an accident, will not be able to access these services. Now, we did a spot check around the county of Uasin Gishu, and we can report that a number of doctors have already shown up to work, as others abstained totally coming to work. But we understand those who came to work, speaking to them earlier, and they sought a lot of anonymity. They did declare that there's a lot of stigma around it, and so they just had to come to work. Now, granted that health is a devolved function here in the counties, we did expect that COG would continue pushing for negotiations with the doctors, but the latest communication coming from COG through their chair, Governor Paranya, is that some of the things doctors through KMPD are asking for can only be facilitated by the national government. A life insurance policy, a proper health cover, and also some remuneration, which would require the attention of SRC. And so at the county level, the governors here have sort of passed the ball to the Ministry of Health and the national government. For now, back to you in Nairobi, Zainab.
All right, thanks, Lois. Now, and just to clarify this, the doctors' strike has only affected the public hospitals across the country. So far, no private hospital has been affected by this strike. And like we said, the Kenya Medical Practitioners and Dentists Union is in Kisii County this morning, where the medics have gathered to bury one of their own who succumbed to COVID-19 related complications. Aoko Kusa is there. Aoko is joining us. What more can you tell us on the strike notice?
Well, Smitty, there's a lot I can tell you about this particular threat by doctors to go on strike. Actually, it's not a threat because the strike, according to the doctors, has already kicked off. It kicked off at midnight, that is waking up today. And of course, they say all the doctors are expected to be out of hospital as we speak. This, they said, just a short while at a Kisii hotel, and before they moved here at the home of the late Stephen Mogusu, one of the doctors who is said to have died out of COVID. And of course, they're also saying that actually his death embodies what the doctors are striking about, which is demanding for safety at their places of work. They're saying that this strike is no longer about pay rise or money, but saving a life, and that is why they're insisting that they'll only be going back to work after the government has met some of their demands. One of them, which is key, being improving their situations at their workplaces, that is provision of standard personal protective equipment. They are demanding that, and also two other crucial things they've pointed out is a group personal cover, life cover, and comprehensive medical cover. They're saying that they will not be stepping back into those institutions until those two covers are put in place. They're saying that the group group medical comprehensive medical cover is supposed to take care of the doctor's treatment should they contract infections during or in the course of their duties, and while the group personal life cover is supposed to take care of their compensations should one die out of infections and therefore or get infected, get a long-term infection in the course of duty, then that particular cover should be able to sort that particular medic out. So those are the demands they are putting forward. They're also asking the government to stop intimidation. They're saying that no amount of intimidation is going to bring them back to work. They're actually asking the CS for Health, that is Mutai Kagwe, not to threaten them with sacking, saying that threatening a doctor with a sack is like threatening a fish with water. And besides that, they're also saying that no court orders will make this strike stop, will not bring a doctor's life, a lost life of a doctor back, and therefore they will not bow down to any form of intimidation, and that this strike is on. They're saying that they gave the government up to 36 days after their 21-day notice expired. They added another 14 days for dialogue, but that has not yielded any fruits, and therefore they are determined to carry on with this strike until the government will calm down and hear or meet some of the demands that they have put forward on the table. So that is what is happening now. As you can hear in the background, the funeral program is already underway here in Nyatieko, where the late Stephen Mogusu is supposed to be laid to rest later on today. And we have just seen the arrival of all the KPMDU of union officials who earlier on addressed journalists at a Kisii hotel arrive here to condole with the family. Back to you, Smitty.
All right, Kokusa, and to Nakuru County, where our correspondent Bridget Ngana is there. Bridget, Nakuru County is one of the hardest hit by the pandemic. What does a doctor's strike really portend, do you think?
Well, you've mentioned we're dealing with a cocktail of two things. One, a crisis in terms of the health of the county, the doctors' strike already ongoing, and also the issue of the coronavirus. But right now I can say that our efforts to get doctors from the county, right now I'm at the Nakuru Level 5 hospital, and also the medical superintendent, has been difficult because they've been holed up in meetings, back-to-back meetings. And we've also gotten communication from the regional union representatives from KNPDU. And according to Dr. Teller, I'll just read a snippet of what they're saying, is that they're applauding the efforts done by Nakuru County